Hey, welcome back to the Aesthetic Show. I'm Dr. Mark Berman, and my first guest today is really going to get me kicked out of the Me Too movement because she's one of the most attractive doctors I've met in a long time. Anyway, this is Desmer Destang, and she's a DDS and MD, and she's a very powerful person in the aesthetic industry. And I want to welcome her to our show today. Hey, Desmer, welcome.
Thank you so much,
Dr. Destang.
Dr. Berman, thank you so much.
Two doctors
for
we
having
have
me
talked
on.
together. So listen, let me ask you, how'd you even get involved in the aesthetic business?
Wow, my involvement started a long time ago. I would say probably more than 10 years ago. So I remember in 2006 approaching Allergan because I needed to get Botox for my orthodontic patients with gummy smiles. And all the way back then, I was doing these treatments for gummy smiles in the lower facial area, which is actually considered an advanced technique nowadays, but I was doing it all the way back then. So I've had a long history in aesthetic medicine, all the way back when fillers had no lidocaine. And one of the things that hit me when I started doing aesthetic medicine back then was that nobody really discussed the anatomy of the face, facial musculature, the bony structures. So there's been so much that has evolved in aesthetic medicine, and it really did start a long time ago.
Your background in dentistry must have really given you a lot of input to move you forward in this then.
It did, especially being an orthodontist, because when I would do all of these trainings for Botox and fillers, it hit me that a lot of these, the trainers didn't know how to do nerve blocks. Also, they would point to, certain parts of the face to give the injections, and I would always be thinking, that point has a name, So my orthodontic background was a tremendous help in getting me to evaluate the face, facial changes with aging. So yeah, definitely.
So who really influenced you? Who are the people that really got you going into this area?
A number of people. My training really, in 2007, I got more into wanting to learn more. So I started off with the American Academy of Aesthetic Medicine, which is run by Dr. Michel Delune. And I was already comfortable with doing Botox fillers, that came easy for me. But then there was the aesthetic dermatology part of it, which was a challenge for me and a lot of the other doctors. So Dr. Michel Delune was one who got me into the concept of skin conditioning. So I have to thank him for that. And then, I had to do more training. And there was Dr. Zeno Baji, many years ago, who was a great help in helping me to get a better perspective of the power of what cosmetic dermatology is.
Well, you're in the Caribbean. You must have some different challenges working on people with a vast variety of pigmentation.
Yep, a lot. And with dark skin, especially in our region, the UV index is very high, so it's hot. So imagine, dark skin, pigmented people, we get a lot of acne lesions, we get a lot of melasma, very difficult to control all of these in the Caribbean heat. So I had to formulate, based on everything that I've learned from all of my mentors, I had to create protocols that worked for our population. That would have included me having to formulate peels. For example, I was instrumental in formulating the Milano peel system, which we had discussed earlier, which is amazing. It's based on mandelic acid, and I mean, I've tried so many different peels on the market, and that range by far has been one of the best in terms of having an ability to control acne, pigmentation, having a high safety index for dark skin.
Is there something special about that particular acid? Was it the concentration, something different about it?
In terms of the formulations, based on the understanding of the skin, I've had to come up with 9 different formulations, all to be safe for dark skin, but at the same time having to deal with different skin types within that ethnicity. For example, you'd have those that have predominantly oily skin. You also have dark skin patients that have acne rosacea. But that being said, even if I am talking about dark skin patient, these peels and peel formulations are also fantastic for white skin, and we have so many mixes in the Caribbean. The range of what I work with is fabulous for everybody.
So where do you see yourself going over the next several years with work in the Caribbean? Are you going to move to the big island?
No, I like my small island. I do a lot of training. I do a lot of selective training for physicians who want to do one-on-one training, especially for skin of color. I am one of the senior lecturers with the American Academy of Aesthetic Medicine. I'm also one of a tutor with the University of South Wales in the UK. So I'm very academic in terms of helping physicians understand the science of aesthetic medicine and what they're doing, rather than have these companies, pushing on them, nice, bright, shiny, pictures of devices and skincare products. So I help physicians understand the science.
Are you offering training sessions in St. Lucia?
It can be arranged, and yes, I do offer it.
That might not be a bad place to come for a training session.
You should.
I'm on the way. Do I have to sail down, or I can fly in?
Anyway, sail, yep.
That'll be great. So now that most of the work you're doing is really skin resurfacing and stuff like that, are you working with any other devices, threads? Do you have any opinion about fillers that you particularly like working with?
Yes and no. I'm not going to be calling any brand names, but
I don't mean that, but yeah.
I do a lot of facial sculpting with threads. So we've had Botox and fillers that have been wonderful for helping us, to control the wrinkles, anti-aging, and then we have threads that have added this brand new dimension in terms of helping me to sculpt the face, changing the facial structure. So threads have been fantastic, and I have worked with different companies. I've researched for them different techniques, because I have trained several parts of the world in techniques for doing threading. And I do advise companies in terms of what works, what does not work, the different techniques, and also techniques that are proprietary to me that I use. And and it's challenging because in the Caribbean we have very thick skin. So darker skin patients tend to have a thicker dermis. So to achieve that lift in darker skin, it's a little bit more difficult. So there are techniques that I have that help me a lot in terms of getting the patients good results.
Pretty good stuff.
Thank you.
Your patients are coming to you mostly because of aesthetic, or are they coming through your dental practice, or both?
Well, I have
two
separate practices, so I wear 2 different hats. On some days I do my orthodontic patients, which is one form of aesthetics. And then on other days I have my laser clinic, where we handle a lot of acne patients. We do a lot of laser hair removal. So I keep it all separate.
Are you doing any body work, or is all your work
we do weight loss. And I mean, it's fantastic now because there are so many treatment modalities that you can combine. So for weight loss, we now have injection therapies. We now have devices that are a lot more effective.
Are there any particular, changes that you've seen that people want because of social media? Are you, heavily influenced by that, or your patients are?
Of course. I mean, everybody's, taking selfies, so wants really nice, clear skin. A lot of patients want this nice V-shaped tapered look to their face. And yeah, social media is putting a pressure on, on everybody in the industry. I have younger patients that are coming in that want to get, lips that look like Kardashians. So, I mean, we have it. We do have the pressures, yes.
You know what, it just seems like there's so much pressure on young kids today. I don't know how you get through a day with social media.
It's with experience, you tend to know the patients that are mature enough, that psychologically mature enough that you can safely do the treatments on. And you do have to keep in mind that young patients can also suffer from a body morphic disorder. So you do have to be careful, and it really is experience that helps you to know how to treat this one and stay away from the other ones. Yes.
Well, Dr. Destang, thank you for joining us
Thank
today.
you so much,
It's a
Mark.
great way to start the afternoon.
Thank you.
And thank you for being with us.
I appreciate it.
Okay, so that was Dr. Desmer Destang, and what a terrific way to start out the afternoon at the Aesthetics Show. And our next guest is Dr. Warren Seiler. I had a chance to meet him yesterday. Actually, he gave a great talk about his work with PRP. So we're going to get to meet Warren in a second and get to see what he has to say this afternoon that you're going to want to hear about. Hey, Warren. Good to see you again.
You too.
All right, so yesterday I get to listen to Warren. He's really well known for work with the Vampire Lift. And why don't you tell us what's going on and what are the new areas that you're really concentrating on?
Sure, yeah. So a huge part of my practice is PRP. It's really changed my practice. I do nothing but laser and injections. I think the two biggest things that we do with it is we can tackle a patient that can't handle the downtime of lasers. Vampire facial is obviously microneedling with PRP. I think we can treat a lot of things that we used to treat with lasers that we can treat now. Acne scars is number one. It really just helps rejuvenate the patient's face without them having to do bigger procedures, but we use it a lot before and after our bigger laser treatments. It works great before CO2 to really get the patient ready to heal. It's a great follow-up procedure afterward. That's the Vampire facial itself.
Okay, let me ask you something.
Sure.
Who coined the term vampire facelift? And when it was first used, what were they trying to mean by it?
Sure. So that's great. We explain this to all of our patients. So Charles Runnels, I'm in Alabama. Charles Runnels is about 4 hours south of me. He's the one that coined the term. So it's a trademark procedure that you have to be certified to provide. Unfortunately, I think the media has taken the word vampire and made it all about blood. And what he realized before he created the procedures and really kind of coined them was that using PRP helps tissue to stay healthy. We used to only use it in wounded tissue in surgery, but now we can use it in better tissue to keep it even healthier. So the idea of the vampire is the vampire doesn't age because they drink their own blood, right? So we use patients' own platelet-rich plasma to help keep them rejuvenated. But unfortunately, patients hear the word vampire and all they think about is blood. And we have to tell them, look, PRP is yellow. It's a very thin liquid. We're not putting whole blood on your face. You don't look like you have a blood mask. So it's something we battle with every day with our patients to explain.
So how do you create the PRP so these people understand what you're talking about?
Sure, absolutely. So we use several different types of centrifuges depending on how much volume and how much concentration we want. Those centrifuges are certified or FDA approved to actually process it so it's sterile. So it's a simple process. I mean, my team draws blood depending on how much blood we want and which type of kit, right? We draw it right from the arm. And it's if you use one of the tube processes like Eclipse, it's a simple single spin, takes about 10 minutes, and then you draw the PRP off and you're ready to either use it topically with microneedling or inject it like I do with filler. One of the double spin systems will give you more volume. It takes a little bit longer and you can draw a little bit more blood, but there's a very streamlined process to do it correctly.
So from the time the patient shows up to your office, how much time do they spend to get this whole procedure done?
So whether we do the Vampire facial or the Vampire facelift, again, the Vampire facelift is just injections with filler, no microneedling. Vampire facial is microneedling with topical PRP. They're there about 2 hours. We generally numb them for about an hour. We get them numbing first after we've obviously taken pictures and cleaned their skin. We draw blood after they've had the numbing cream on, and then that gives them time, my team time to process the blood. The vampire facial itself takes about 30 minutes for them to do, and then I can inject PRP in about 5 minutes. If I do the vampire facelift, it takes me anywhere from 30 to 45 minutes to inject the filler and the PRP together. So,
And can they drive themselves home? Do they come with a friend or what?
absolutely. So there's no oral anesthesia. We use a really, really strong topical numbing cream that's plenty. The only reason why we use the numbing cream for the vampire facelift, which is the filler plus the PRP injections, the injections themselves don't really hurt. It's just because of the sheer number of injections. Like I showed a picture yesterday in one of my lectures that I injected the patient about 75 times between filler and PRP. So for that patient, the numbing is just to keep them from getting tired of me sticking them. The numbing cream for the vampire facial is to help with the discomfort from the microneedling, but I've had 2 of them done. I mean, it's really no big deal.
For an 85-year-old guy, they look terrific too.
I appreciate that. A little bit of Botox and a little PRP.
Sells his own procedure. So, okay, so now the needles you're using for the injection, are these little tiny 30 gauge needles or?
Yeah, so sometimes you can get the PRP through a 30 gauge. Sometimes we use a 27. I never have to use something bigger gauge than 27. If you're gonna just do it topically, you just drop it straight out of the syringe on top of the microneedling. So yeah, I mean, it's a tiny little needle.
That's a nice procedure then. That's really the bulk of your practice right now. Are you doing other things that are augmenting your procedures with the vampire lift and
Sure,
the
so
needle?
I mean, most of the laser procedures in my practice are now done under people, under my supervision. So the bulk of my actual time is consults and injections. So I do mostly neurotoxins and fillers. I do a ton of PRP injections. I think one thing that's really changed our practice is that a lot of people just do the vampire facial or just the vampire facelift, but I'll do PRP injections along with the vampire facial so that we get that stimulation deeper without filler. But yeah, I mean, I do pretty much every laser treatment you can do besides invasive laser lipo. I don't do anything surgical. I'm surgically trained, but I do nothing but laser and injections.
That's a good point. You have some really good surgical background. Of what I understand, you were involved in all kinds of really important stuff. When did you make the transition to aesthetic surgery, and what really pushed you over the edge?
The short story is that I was gung-ho plastic surgery for my entire surgical career. My last year of general surgery, I did a bunch of plastics rotations, networking with those guys before my fellowship. And that was right when CO2 really was starting to become fractionated. We started using other lasers. I fell in love with it. I trained in Birmingham. You may be familiar with Louis Vasconez, who's very well respected in the plastic world. He was my advisor. And I had a talk with him. I thought he was going to kill me and tell me that there's no way that he would want me to not be a plastic surgeon and do this new laser thing, but he was very supportive of it. So, there really is no true laser fellowship. There's a board certification for it. So I spent a year after general surgery traveling to multiple different states to get training, a couple of weeks here and there. Fell in love with just laser and injections and started my practice, and I took a big risk and invested a ton of money in equipment, and we've been firing ever since. So it
Well,
worked
it's amazing to see you end up in Birmingham, but I got to tell you, I spent time there years ago. It was one of the most fun cities I've ever been to. How's it feel being living in the southern states of Alabama?
I love it. Something I said yesterday is that, what I love about this conference is you see so many different people from so many different types of practices. In Alabama, we do have a relatively conservative town. A lot of things are kind of quiet, so it's nice that I have a very conservative practice. I mean, if you sat an hour in my practice, it may not necessarily look like I have this cosmetic practice where people look like they're doing cosmetic treatments. I like being very conservative. My wife and I live in downtown Birmingham. We love it. She's from there. I'm from Arkansas originally, so similar areas. But yeah, we love Birmingham. It's great. There are a lot of cosmetic practices in Birmingham. You'd be surprised at how saturated Alabama is with cosmetic physicians and non-physicians.
My first introduction down there was with Galen McCullough.
Sure.
And he would have these big meetings and take everybody over to his house and all around town. We had some great times.
I trained with his partner, Gus Diaz, who's now in North Carolina, facial plastic. So I met Dr. McCullough when he was already down in Gulf Shores. Beautiful place down there, really nice guy. And I tell you what, he's still operating like mad. He sends me a number of patients for laser resurfacing after
Good.
facelift. And
You took over a spot in Birmingham. Not a bad gig. Well, that's great stuff. Do you have anybody, do you work with a group or you have any partners or are you on your own?
no, I'm a physician by myself. In Alabama, you have to be an MD or a dentist to do injections. Only MDs can do ablative lasers, so I do all the injections and ablative lasers. My staff does, the other laser procedures like laser hair removal and stuff like that. So I do all the injections.
Are your staffs registered nurses?
So it's interesting.
How does that work?
In Alabama, there's no difference in the non-surgical procedures between an esthetician nurse and a nurse practitioner or PA. So actually, my entire staff is estheticians. I have 5 estheticians. None of the procedures are done without me being there, so I'm very involved in all the procedures that they do. But they're all estheticians besides my patient
It's a good
coordinators.
point. I've worked with some really top-notch estheticians in Beverly Hills, and they are so well trained, they're so hands-on. In California, we have much more restrictive laws about what they can do, but they seem to be doing so much, and you really
Right.
trust them because to take
I
care of
think
your
it's
skin.
all about the person. I think there's a lot of argument about who can do what. I've always kind of had the philosophy that if you decide what you want to do, regardless of what background you come from, you get the right training, you specialize, you take your time, you be careful, you treat patients well, and I think a lot of people can enjoy doing these procedures well, but I think there's a lot of danger if you don't know what you're doing.
Well, Dr. Seiler, it's great
you.
having you here this
You too.
afternoon.
Absolutely.
All right, thanks
for
for
your
coming
time.
to the
Appreciate
Aesthetics
it.
Show. And that's Dr. Warren Seiler. Our next doctor is Dr. Alan Wu. I've known Alan for several years, and he is one of the top scientific researchers in the area of stem cells and exosomes. And I think, Alan, welcome.
Dr. Bierman.
Hey, look at this. I get to actually interview you here. So this is Dr. Alan Wu. And Alan, what's the latest work you're doing now with exosomes? Tell us all about it.
So what we're doing...
So we can understand it too.
Okay, so very simply, exosomes are basically small, tiny little liposomal blebs that are about 30 to 1,000 nanometers in size. And it's basically the way in which cells will communicate to one another. What is very interesting is that stem cells in particular prolifically secrete them and use it as part of their ability to regeneratively reprogram genomically the cells around them to recruit other cells to help a particular traumatized or damaged area. So one of the things that we've developed is a method of isolating exosomes with minimal manipulation and actually take those exosomes and place them on the skin after, say, for example, somebody has had something like microneedling, fraxinated energy, like Fraxel CO2 or erbium YAG, and actually give the patients a faster healing and a better outcome in terms of the quality of their skin afterwards.
These are so small, they actually get absorbed right into the skin.
Well, obviously we always have to get past the keratinic layer, but with the microneedling and also the fractionation, it is possible to get the exosomes into the skin.
If you microneedle, are you concerned that the bleeding is going to just push them out, or are you pushing them in with injection through the needles?
That's a very good question. One of the things that we have to do before we actually do the microneedling and application of the exosomes is using a particular buffer system to keep it in the pH that is ideal for the exosomes to work. And then afterwards, you have to use a sealant that is in favor of allowing the exosomes to continue to do their work later on when the patient leaves the office.
What's the source of the exosomes?
What we do is we actually harvest the exosomes after the patient receives standard liposuction. They can have any sort of liposuction, use any device, but afterwards there's always that infranatant layer. And you and I have talked about this before. In that infranatant layer is stromovascular fraction and adipose stem cells. And so all you do is you take off that residual fluid and those free cells, put it on the binding column, and then isolate the exosomes.
Okay, so once you get rid of the cells, you can actually isolate the exosome. Is it through a filtration process, or how do you actually do that?
Very good question. The proprietary technology is all
That's
in.
why I'm here interviewing you.
The proprietary technology is all within these special reagent beads that are in this column. And what it'll do is it'll actually hold on to the fat stem cells. Now, afterwards, you'll actually place a little bit of crystalloid in the tube itself and then flush out the exosomes. the cells actually stay on the reagent beads. And what's great is that afterwards you could actually take that column, put it in a mail pouch, and send it to any tissue bank around the world and actually bank your cells.
You made a point though, didn't you say it's difficult to freeze these things?
Yes, exosomes, they can be frozen. They can actually be left at room temperature as well. The difficulty with room temperature is that if your setup is not RNase free, the RNA will usually degrade overnight. If you freeze them, it can actually go through, the exosomes can go through a type of saponification process and actually cause the breakdown of some of the exosomes. Some of the larger exosomes seem to be a little bit fragile, and so we get concerned that the freezing process may change the characteristic of the exosomes isolated.
This is really neat stuff. So you're basically talking about personal cell therapy, making your own personal exosomes, so you're not worried about risk of virus or prions or some kind of external contamination.
Exactly. Since it's autologous, it's the patient's own material.
So if you needed to, you could actually freeze their fat or whatever, and then you can always take samples of that, make the exosomes later too.
It is possible, but one of the things that we do notice is that fresh exosomes versus cultured exosomes, the fresh ones seem to function a lot better.
What if you took cells that say you cultured stem cells, and then you thawed those out, and then made exosomes from that? How would they work?
That is definitely a possibility. And there are other people working in the space now too. 10 years ago, there was nobody working in this area, but now we have things like Chimera Labs and ZenBio who are actually producing supernatant-derived exosomes from adipose-derived stem cells.
You guys understand this at home now? Did you hear what he said? You can get the fat and make your own exosomes. You got little beads, start using exosomes. How easy is that? I feel like Martha Stewart of exosomes. Listen, this is really good stuff. I'm starting to really get some good ideas from you. I always got great ideas from you. Where do you see this thing going in the next couple of years?
That's a very good question. Right now, we're just focused on homologous use and just kind of healing of the skin. That's what the fat stem cells and what the fat stem cell exosomes are supposed to do in the first place. But now we're starting to look at the other possibilities of treating other types of issues and problems like osteoarthritis. We do know that use of mesenchymal exosomes in osteoarthritis models, animal models, is very compelling. The preliminary data coming out is just quite amazing. And we are seeing that they're able to regenerate cartilage with just the exosomes alone. So there's a lot of interesting biology going on.
Do you think there'll be any symbiotic, use of exosomes and say SVF or stem cells together, or do you think, you need one or the other?
Another excellent question, and we've talked about this before, and I've always approached you and said, well, if I handed you a scalpel and said, Dr. Berman, this is the last tool you're ever going to use for all of regenerative medicine or any surgery that you do, you'd laugh at me, right?
I always laugh at you.
Well,
funny guy.
But,
this is funny to us, but I don't know if anybody understands what we're talking about.
But you know and I know that there is absolutely no way we're going to be able to attack all of regenerative medicine and aesthetic medicine with just one tool. And so exosomes are going to be important, but just as important is still going to be SVF and live cells.
Do you think you're going to come up against problems with the FDA? What's the FDA starting to do with exosomes? Are you on the back burner?
Well, first of all, within our field and what we're doing with R3Gen.com, at R3Gen, what we're doing is we are simply using minimal manipulation to isolate the exosomes. We're also using it in a homologous context of just basically skin regeneration. And then we're also using it in an autologous fashion, unadulterated, since we're only using crystalloid. And then on top of that, we are not affecting anything systemically, and we are not having a change in the basic function or characteristic of these items.
You know what, honestly though, you don't own the cells, right? These are natural occurring products. The patient owns them.
Correct.
You're really not manufacturing anything, you're just separating out. You're doing more than we do. When we separate out cells, you're separating out the exosomes from the cells. So technically, who owns the cells?
Well, the patient always owns the cells.
So you can't even sell it to them.
Well,
are you selling the cells or are you selling them your service?
We are not selling the cells. We are only giving them back their exosomes, and that's it. We are not taking any of these exosome or cell products and transporting them across state lines. And I suppose that if you wanted to say that there was any interstate commerce, the only way in which you'd be able to physically do that is go to the Hotel Royale where they have that border between California and Nevada, put a leg on one side and the other, and then give the patient exosomes. So there's no way these products, even cellular for that matter,
Right.
could be considered interstate commerce.
Yeah, it's not, well, it can't, you know what? It can't be considered commerce unless you can own it to sell it.
Correct.
I would think that's the case.
I agree.
Anybody out there at the FDA, please listen to this. This is a good point. We need somebody to listen to this. Well, this is really, every time I talk to you, I'm just really excited about the new stuff you're doing. This is really exciting stuff. You're really moving us in a really important direction, I think. Are you doing any standard cosmetic work these days?
Yes, most of it is primarily within the Torrance, Irvine, and Palm Springs area. And also a lot of it is related to the work that we're doing with exosomes. I am still working from head to toe, all the way from hair restoration, face thread lifts, body breast lift, abdominoplasty, all the way to veins. And also I'm doing robotic surgery work and trying to, like Farhan Tagizadeh, trying to bring these technologies together, robotic surgery and regenerative and aesthetic medicine.
Well, good stuff. Alan Wu, Dr. Wu, it's
Thank
so
you,
good
sir.
to have
Nice
you
to see
here.
you.
I really appreciate
Thanks.
it. Thank you. Well, that's Dr. Alan Wu we've been talking to, and he's really one of these leaders in the scientific area of exosomes. Next up, we have Dr. Christine Petty, and I'm going to see if I can learn something about the future of body shaping from a a board-certified plastic surgeon. And it's so nice to have you here. Thank you, Dr.
Good to
Petty.
see you, Dr. Berman.
Dr. Petty,
Yes.
what's the challenge with body shaping today? I mean, are you just getting, inundated by things off the social media? Is it everything the Brazilian butt lift? Whose took us are we copying this year?
I think there's a wide variety of tuchuses that we can copy, which is beautiful because you can make it individual for each patient. But there is a popular type which has a very round projection, and we can do that with liposuction, with laser liposuction, with vaser liposuction, and we can also do it with fat grafting.
Are your patients coming to you under a lot of pressure to look a certain ideal way?
Absolutely, yes.
And what do you tell you get people come in, you must look at them and say, you're perfect, you're good looking. Is it hard to turn somebody away when they've made up their mind they want to get something done?
I try not to do things that are not necessary, obviously, because some people come in and they're very close to perfect. I don't know what they're looking for, so I think there's a danger sign sometimes. You try to get a feel for what it is that's bothering them.
So where do you see everything headed? Is there a body image? Or we just kind of go up and down with we want a big butt, a small butt, or is there the Fibonacci ratio, where you have certain proportions? Are people still willing to listen to you?
The golden ratio, yes. I mean, the golden ratio, we're kind of out of the golden ratio when it comes to some of the body contours that are very popular these days. But again, we have to kind of go with the flow, what's popular.
What's the most common thing you're working on these days?
I think it's liposuction, getting it to the point where you're really sculpting it down so you have very, very beautiful anatomy, and then also complementing that with fat grafting.
What are you doing for liposculptor? Are you using energy or using?
I'm using energy. I have been using laser energy. That works really good in my hands because I'm able to get into areas that, it's difficult to do with if I can use a laser that's very flexible, I can get into areas that I can't get with a stiff cannula. Mm-hmm. And then I can also melt the fat, and I think melting the fat with the laser helps me to get a better result because I'm not fighting so hard to remove the fat, and then I can feel in terms of sculpting, I can feel a lot more if I have it, pre-treated, pre-melted with the laser.
So are you seeing people coming in who just can't get rid of the fat, or are you getting a lot of people who just have bad diets and they need you to, jumpstart their engines?
I think, it's a variety of patients. Of course, sometimes if you have somebody who is a little bit overweight, it can give them a good incentive, because a lot of times, or it could be somebody who, for instance, just can't get rid of weight in one area. That's super frustrating, especially for women, because they may work out, but they have what I call genetic fat. It could be in their arms, it can be in their abdomen, it could be in their thighs. So it's really exciting to be able to use liposuction to give them something that they couldn't acquire any other way. So that's very satisfying for me.
Well, I remember learning liposuction years ago when it first came to the States, and it was always something we thought, wow, this is great, we're finally getting rid of this fat. Are you using fat for transfer procedures besides buttocks, or what else are you using it on?
Also I think it's really good for enhancing around redo breast, because a lot of times, if somebody's had breast augmentation, then they have undesirable results or complications, wrinkling. If they have visible wrinkling, if they have areas that, asymmetries, and you correct that, you may be dealing with somebody who has not the best tissue because it's been worked on before, thinned down. If you have to take capsules out, then you're going to have to sometimes thin the tissue down to get the capsules out or to get rupture out. So I love using the highly cohesive breast implants that really feel very natural, and they come in different shapes and projections, which is nice to have the patient have that ability to select. It's kind of like going shopping, and you can tailor it to the patient and with the rest of their body contour. So maybe you're going to do a redo and they have thin tissue, then you can let them recover from the redo breast implant surgery, and then if they have any thin areas, you can do the fat grafting at that time. A lot of times I like to stage it, because you don't always know what you're going to get. So you want to make it as natural as possible. So I think you can refine things sometimes if you stage it.
That's a really good point, because I think a lot of people are afraid to combine procedures, and that's an excellent procedure you can add. It'll really take you, I've seen people who are losing implants, for example, and you have to take everything out. The skin's so thin. Have you had experience with trying to improve the quality of skin as well as the subcutaneous tissue?
Absolutely. I mean, I believe even in the face. I mean, if the skin is supported, it seems to have better dermal structure than when you have loss of subcutaneous fat. It's better. So the same thing with the breast. I mean, the chest skin can be rather thick, and I think if you augment that support, then the dermis responds to that.
It's a great way of improving the dermis. On the stem cell side of things, have you investigated saving some of your patients' fat, or we have somebody coming in, and I hate the idea, you're just throwing out all these great stem cells.
I think that's wonderful. I've been using PRP, so platelet-rich plasma. So we do a lot of that, where we draw the patient's blood, and we use their epidermal growth factors and so forth to enhance their results. I have not done stem cells to this.
Oh, good. We got to convert you.
Okay.
All right, here we
I
go.
heard you talking
Lord,
a lot about
please
that.
bring me this lovely doctor to the stem cell arena.
Okay, I'm ready.
I'll let you get in trouble with me too. Well, this is great stuff. All right, so now we got the next 10 years. Do you see any particular trends that you can identify that you think we're going towards, particularly with the kind of surgery you're doing?
Yes, I mean, I think we're getting, I love the fact that everything we're doing can be totally customized, because we have so many options. So I think that, a very shapely figure that's going to stay. I don't think we're going to get back to like the Twiggy. So a lot of the techniques that we're using, to enhance one's own tissues, I think the stem cells, fat transfers, they're here to stay. And then there's going to be the ability probably someday to actually produce tissues en masse. That's going to come. That's going to come. I don't know if I'll see it, but.
So you're doing a lot of this stuff. What kind of anesthesia are you using for your procedures?
A lot of my procedures, I do a lot of redo procedures. I don't like the word necessarily botch, because,
my next door neighbor films that show Botch.
Exactly, but I mean, we can throw that term around. But I mean, a lot of patients do have undesirable results or complications, and that's kind of of having a mature practice, that's one of the advantages, is they come to you because they know you're experienced. So that's what I think I'm doing a lot of that type of surgery at this time. And so it's much more complicated and much longer, and therefore, to answer your question, it's going to be under general anesthesia. I prefer that.
Well, I think most people really just want to be asleep and not feel anything.
Right.
So
I mean,
that
if they're having major things done, it's better to reassure them that anesthesia has gotten to the point where it is relatively safe if you have a good team, you know, meaning the anesthesiologist and the surgeon.
No, it's a really important thing. Where do you practice?
In the South Bay of Los Angeles, you know, Manhattan Beach, Redondo Beach, Palos Verdes, Torrance.
Volleyball capital of the world, my friends.
Yes.
It's a great place to practice.
Yeah, beautiful bodies there.
Well, you know what? I'm surprised you have anybody to operate upon. You've got great bodies down there. You're no joke.
Yeah, but then, you know, everybody wants a little bit better. So they show up even with those great bodies.
Okay. Well, listen, it's been a pleasure having you, Dr. Petty.
Thank you so much.
Congratulations on all your great work down in Manhattan
Thank you. It's an
Beach.
honor.
It's good talking to you. Thanks for coming
Thank
in.
you.
Hey, I've got the next patient. She's Dr. Petty, Manhattan Beach. I'm telling you, she's in the heart of the really pretty people of LA. The next doctor is Dr. Chad Deal. I've known Chad for a long time, and look at this guy. More handsome than ever.
How are you
so
doing?
what's going on with you these days? You're still doing a lot of Brazilian butts and all this great work.
Absolutely, doing a ton of those and also training a bunch of doctors. I think we're putting on courses now almost every other month. It's a hot topic. A lot of the news, reported deaths are actually been high, 1 in 3,000 according to ASPS, and so safety is paramount. There are ways we know how to prevent these, and so we're trying to educate as much as we can. The World Association of Gluteal Surgeons is a big part of that.
What are the biggest complications that have been occurring with this procedure?
So absolutely number one, fat embolism, as we know now. This is very preventable. Studies are being done. There's a consensus statement that's reached by the plastic surgery group, but beyond that, the World Association of Gluteal Surgeons, a collective of surgeons all over internationally, have gotten together to prevent these. This is absolutely, in my opinion, a preventable problem, and are dedicated to that. In fact, the first meeting of that's going to be coming up in January next year.
Well, what do you think are the most important keys to preventing that?
In my opinion, first and foremost, we know that fat needs to be delivered in the fat. We said this. In fact, you and I think, were at that 9 years ago at a talk. We talked fat in the fat. A lot of people are putting it in the muscle. You do get better take in the muscle, for certain. But the problem is you are going to injure the superior and inferior gluteal veins eventually, all right, and you're going to have a fat embolism in that case. So the key is, what techniques can we do to keep the fat in the fat? Right now there's a big push to ultrasound, always putting the fat in under ultrasound. I think probably the biggest technique is actually positioning of the patient in exactly the porthole where you place the fat. So from medial to lateral placement, a little hole just in between the buttock is probably the best approach. Hard to place the fat into the vein or damage the vein at that point.
Let me ask you, actually, this is probably more interesting to me than them, but what size cannula are you using to inject the fat?
Typically a 4. To inject. So, you know, the smaller parcel size, we've already said, you're going to always increase surface area. The smaller parcels of fat, particularly like when you're really getting to nano fat and you're transferring the face to the hands, it's going to live better. The problem is the smaller parcels, the smaller cannula, the less safe it is cosmetically. So a little bit of difference of opinion, but I think probably now the average you'll see 4s, maybe even 5s. Okay, so maybe not as much fat take, but much safer. Hard to injure a vein with a larger cannula.
How long does a typical procedure take you to do?
If we're just harvesting the fat off of the back and tracing the buttock, it can be as quick as an hour and a half. If you're starting first in the supine position for the patient prone to get as much fat as you can need, or at least the patient wants full body contouring, 2.5 hours. Still not that bad.
You know, it's amazing. I've seen some of your cases. I think this guy does some of the most beautiful butt work I've seen of anybody. But I mean, these people come in, they want a nice, big, round butt.
They do, and there are techniques that exist, the technology's there, it's grown up so much in the last few years. You could do incredible work all in one stage, and if it does take that second stage, at least they still look good in the first.
So you warn them ahead of time that a certain percentage are going to need to come back?
Sure, but I would still say 90% plus, it's a one-stage procedure, and nothing's more transformative. You're not just getting the buttock shape, right?
Yeah.
So much of the buttock is about taking the fat around it to frame it versus just placing it in it. just really good liposuction, good sculpting. I don't even like the term liposuction too much these days. It should be liposculpting, is going to get you there.
You know, it's a good point. I always said, you know, doctors aren't really the best artists. We're usually very good technicians. You don't want to take your car to somebody who's a good artist. You want to take it apart and put it back together.
Yes.
But what you're doing is really sculpting.
Absolutely, and so the idea of high def lipo kind of brought us that. It's a bit, the way I like to describe it is the difference between a cook and a chef. So a cook follows a recipe. A chef knows what he wants his dish to taste like at the end. So it's all about being an artist. You're not following a recipe. Every patient is different. Their contours are different. The fat is different. You know this. You go to some people, it's very fibrous. Even people who haven't been operated on before, and some it's very, very soft. So it's about being an artist. Notice what you want your patient to look like in the end, and whatever it takes to get there.
Are you ever worried that you don't have enough fat in your patients? They come in with unrealistic goals?
Yeah, but with really good contouring, you can get most people there. And there's a lot of research in this. A lot of people have had that kind of Sculptra, buttock augmentation. And there's actually a lot of buzz right now surrounding Radiesse. Hyperdiluting the Radiesse, not only do you get the initial fill with the Radiesse, but you're actually causing enough of an inflammatory reaction, building up the collagen that over the course of several treatments, and there are ongoing studies based on this. A lot of them are coming out of Latin South America right now.
Okay. All right, so what else? What are the other big procedures that you're working on these days? Have you gone into something new or different?
There is something I'm doing new. I don't want to say too much because it will be a proprietary thing. But about 5 years ago, there was a lot of buzz around how to do augmentation with just liquid only. We have figured out a solution to get it to last more than 2 to 3 days, more than just, if you just put saline in a breast, it will last you 6, 7, 8 hours. We now have a solution that can last about 2 to 3 days. So if a woman wants to come in and see what the breast will look like, we can now infuse it through completely awake, painless, 5-minute procedure, make a breast up to 500 cc's per breast in a solution that will last. We're calling it the Weekender. We haven't quite done the big burst yet with social media, but it works. I've done the side-by-side studies versus saline, and I'm keeping the formula right now kind of secret.
Well, you know what? This is great for dating. I mean, if you're going to meet somebody for lunch and you get to meet them for a couple of days, you might be a little bit surprised the next week.
It's cheating a little bit, okay, but it's a lot of fun. It's something that works great. And honestly, for anything, before someone goes into surgery and they go through that, to have that preview and to know, is this something they like? And in fact, even sizing. Up to 500, what size do they want? So it's a good opportunity for them to do that.
Pretty good idea. It's a pretty good way of seeing what you need, too.
Absolutely.
How close is it to, if you put in 500 cc's, is that going to be approximate of what you need for an implant?
It's extremely close. So of course the implants, in many cases, I'm putting them under the muscle, you lose a bit of your volume. So if you were to put a 500 cc, it may look closer to maybe a 400 cc if it were above. And all of this fluid's being injected directly into the breast tissue. Mm-hmm. So you have to compensate a little bit for that when you're going into the muscle, but pretty close.
That's some good stuff. I hope we didn't steal any of your proprietary information there.
Not yet. Not yet.
So, okay. Your practice now is just strictly cosmetic. Mm-hmm. Have you gotten the stem cell buzz at all, or you're just too busy?
Man, I love, in fact, it's taken a lot of guts. It's taken people like you, in fact, specifically you, to take on, well, I have to say it, big pharma, big government. A lot of money involved to defend what we should all have the right to do, which is make our patients' lives better, both functionally and cosmetically. And it took a lot of guts, and you deserve a lot of the accolades for that. We're following very closely the hard work that you're having to do legally. A lot of us are really rooting for you because we hope to see that patients win and physicians win, and government and big pharma doesn't win in this case.
Yeah, well, if we lose, look for my wrist size so they don't pinch these wrists when they take me away.
I don't know if everyone knows this. I don't know if everyone really researched it, but Dr. Berman has taken on a very, very tough fight, and he's done it on his own almost. And all of us are going to benefit greatly if he can win this.
Well, I appreciate that. Listen, the government's looking at a lot of our cosmetic procedures. If they're right about what we're doing with stem cells, theoretically, when you move fat around, you're doing the same thing.
Exactly.
It's a surgical procedure, taking about fat and moving it.
100%.
Okay, so now you're still using regular implants, right?
We are. The implants have really grown up. Everything from your softer to more firm implants. Textured, of course, is beginning to fade out again. It's actually kind of its second fade, if you will. It faded out many years ago. Concern was affections in the past, and now there's these extremely rare cancers. Again, very, very rare. but now it's beginning to make them less popular.
Have you ever seen one of those cases?
I have not. And the way I really try to describe it to my patients is, look, when you get to statistics it's more dangerous on your drive-in to the office than it is of you developing one of these cancers. At some point, you have to understand what these risks really are. It is extremely rare. It has only actually been with one company, I believe, and it's only been with textured implants. So the hype and the concern around it, it should really die down. Unfortunately, that's not the way it always happens.
It's amazing. I don't think I've had one patient come in and even mention it. No. And I mean, we do capsulectomies all the time. Let me ask you something. That's a good question. When you do a capsulectomy, are you sending your capsules in for pathology all the time?
I mean, if they're calcified, I always do. If they ever have any of the, sometimes you'll see some black discoloration, which can represent a fungus. Certainly, sometimes if I see that they're operation overseas, you tend to see more of these mycobacterium and other more rare fungus, and then I'll send them in. But if it's just a little bit of a thickened capsule, the Baker grade isn't too bad. No, generally I don't send them all in.
It makes a lot of sense. Otherwise, we'd just keep the pathologist working all day long.
Right.
Hey, Dr. Deal,
Yeah.
so good to see you.
Very good to see you.
Terrific. Keep up the good work.
Thanks, sir.
Thanks for coming in. All right, well, so we're going to wrap up here, and we're going to throw you to a video of Dr. Joe Niamtu and Dr. Aguilar. I'm sorry, Shinobe Aguilar. And they've got a nice little video for you to see. So enjoy yourselves, and thanks for listening to the Aesthetic Show.
Hey, I'm Dr. Joe Niamtu, and welcome to the 2019 Aesthetic Show in hot, steamy Las Vegas, Nevada. And I'm so honored to be on this desk interviewing some superstar personalities, and we have one right now. So we're going to talk to Dr. Shinobe Aguilera. Now, that's just not three names, all right? You know, there's some people that you can just one name, right? Cher, Sting, and if you just say Shino to anybody that has anything to do with cosmetic dermatology or cosmetic surgery, they know who you're talking about. And I'm stealing some of your time, but this guy is so special for so many reasons. Number one, he's the nicest guy in the world, and he and Alejandro are great friends, and he always has time. The poor guy, it's like Paul McCartney walking out there. People are grabbing him and asking him questions, but he always has time to answer, and he is so good at what he does, okay? And plus, look at that damn hair, bro. Come on, man.
It's Korean hair. It's very expensive.
Shino, welcome.
Thank you.
So great. He's usually on Jimmy Kimmel or something, you know, but he's here today. So if you followed us walking around a little earlier, we were with BTL Aesthetics, and we were talking about Emsculpt. And Shino is an expert in this. So let's just start for people that don't know anything about what it is.
Yeah, so it's an amazing novelty for us that getting older and can work out as much as we used to, or just trying to get the body type that we, at least for me, I actually bought this machine for me. I don't care about the pleasure. I bought it actually for
So you
me.
have your own at home?
So
huh?
no, it's not at home, but it's at the practice. But it's basically electromagnetic energy, high frequency focused electromagnetic energy. And basically what it does is allows you to reduce the abdomen fat reduction for about 19%, but it's the first machine of its kind that not only gets rid of fat, non-invasively, but it actually makes you grow your own muscles. So I have back my six-pack that I had when I was in my 20s.
You know, that's pretty amazing, and I think one of the important things here, when we were in the booth talking to Dr. Kent and talking to Brian Kinney, another person like Shino who's been involved with this, they really made a big deal about the research that's gone into this, because as you know, there's a lot of devices out there that put a battery on and put something on you, and they really don't do anything. But I'll tell you, this has been such a buzz, so there is good science behind this.
Great science behind. I know a lot of people thought, you know, the electromagnetics, that's just electricity. Well, the body conducts electricity, so you may have muscle contraction, but you will never going to make the muscle grow. With this electromagnetic contraction, it's like in 30 minutes, it's like doing 20,000 sit-ups. No one has the time or the ability to do 20,000 sit-ups in 30 minutes. So the protocol of this treatment is great too, because in order to have those great abs and get rid of the fat, you only need 4 treatments. 2 treatments a week times 2 weeks.
And that's it?
And that's it.
I mean, you don't repeat it?
You can do a maintenance, so I do once or twice a month to maintain the results that I got with those 4 treatments.
Well, that's pretty amazing. That's pretty amazing there. So, and it works by electromagnetic energy, right? And so when you're doing this, and we had one of our volunteers doing this earlier, I noticed that you could actually see her muscles twitching. Now there's 3 kind of settings that you go through. You want to talk about this?
So it depends what you're trying to do. There's for the abdomen area, and you can use 1 plate, which I used to do, is a lot gentler, or you could do the 2 plates at once. Again, it gives you the super maximal contraction of the muscle that allows you to grow muscle mass up to 16% and reduce body fat. The supramaximal contraction causes the adipocyte cells to release the free fatty acids, basically stress them out, and then you get rid of them. So it reduces fat but gives you muscle. Then you have the other setting, which is for the butt. For the settings of the butt, you don't want to get rid of the fat of the butt. The settings of the butt is just to contract the muscle, to give muscle toning, and actually lift the butt. So I'm 50 now. I have problem with my knees because I used to be a runner. I cannot be doing squats anymore.
I hear you.
And after 50, everything goes down. Pretty much everything.
Cut. No.
Cut. No, but definitely, I've never seen my gluteal area look better. So at 50, I have a better butt than when I was 20 something.
Okay, and Gino doesn't know this, but we're going to let him show. No, we're not. We're not going to do that. Now, another question talking about the science. So when we stimulate muscle like that, you get a buildup of lactic acid, and isn't part of the final setting here to flush that lactic acid?
Yeah, so in between the treatments, right, you have the supramaximal contraction, and then there's a tapping in between, which feels really nice. That tapping is gonna make sure that your muscle don't retain the lactic acid. So unlike going to the gym and working really hard, and the next day you're super sore, with this, you don't, at least me, I don't feel any soreness the next day. Maybe a little bit, but nothing like the way you feel when you actually go to the gym. So it's really amazing because it's for the kind of people that are really lazy, that you just want to have the results, but all you do is lay there for 30 minutes and you get better musculature that you've been working out. So, but funny enough, the people that really are into this treatment are people that are already fit. Most people that come to my practice, they're already fit. Like me, I have little areas that didn't matter how much I diet, how much I exercise, it will not improve anymore. This took it to the next level. So people are motivated like this, but this treatment is for everyone. From the lazy people to the very motivated people at the gym.
Well, you know, that's awesome, and that's one of the cool things about this arena of cosmetic surgery at this point in time. We have all this new technology, and if you just look around here, I mean, it's overflowing. And we have so many, we have aging baby boomers, and then we have millennials that are entering into this situation. So it's a very broad interest. I think it's a great time to be involved with this. Now, you have to travel around the world as much or more as anybody that I know. How many times in a year are you going to be out in?
I don't know, but I can tell you right now that I'm already booked through April 2020. And I get 1 or 2 weekends a month here and there. So I don't know, but I love what I do. Same to you. We love to teach. We do it from our heart. We want to improve the whole aesthetic industry as a whole, because when we do that, we all benefit from that, right? And that's why when somebody asks me to do it, you know, it's no, because we're making tons of money. Anything, I lose a lot of money by not being in the practice.
Right.
But I gain this personal satisfaction that I'm contributing to this world of aesthetics, and I learn and I get to see my good friends like you.
That's awesome. So, you know, we talked about the M-Sculpt a lot here. And again, man, this guy literally is one of the best known cosmetic people in the world, just hands down. What else are some? What's your favorite things when you're not doing 20,000 sit-ups? What are some other things that you really love doing?
I like to dance. This is for fun. I like to dance. So if anytime I have an opportunity to be on the dance floor, that's where you see me. You know,
Yeah.
It's a good way to stay young. It's when I feel the happiest.
Right.
You cannot feel bad when you're dancing. So it's good for my soul, it's good for my body. But I like to learn. So either, reading articles of my colleagues and trying to bring new technology into my practice, and trying to evolve with everybody, We're learning more about the aging process. 50s looking great, 60 looks sexy, 70s looking sexy. We're living longer. We all gonna care about what we look like, We're not gonna throw the towel just because I'm 60 or 70, I wanna improve the quality of my life because I wanna add life to my years, not no years to my life. I wanna have more life to my years and do things.
Life to your years, not
Right,
years
so-
to your life.
What we do allow for patients to get just that, right? Because if they look at the mirror and they see that they look refreshed or younger, they're gonna do younger things. They're gonna act younger. So we add life to their years with what we do.
Well, you know what? I'll tell you, ladies and gentlemen, if I call this guy the total package because he really is. He's smart, he's good looking, he's fit, he is so nice. And a lot of people of his stature are stuck up and they're all about themselves, but I am honored to call you a friend, brother.
Same
And
here.
so
My
good to
soul,
see you.
brother, I love you.